Turning the corner. That's how Newfoundland and Labrador Health Services is receiving new data from the Canadian Institute for Health Information that is painting a rosier picture of this province's nursing crisis.
Newfoundland and Labrador is doing better than Canada in terms of retention of nurses who are working for over 20 years. We also have a workforce that has more full-time employees in registered nurses than other parts of Canada.
That information comes from CIHI's latest report based on data from 2024 that evaluates Canada's nursing workforce by province and territory. But it's not the only reason the health authority is feeling more optimistic. Malloy says permanent nursing jobs have been created for this year's new graduates. They're float positions, meaning they will move around.
The eastern zones, and we have two zones, eastern urban and eastern rural, there were quite a large number of floats that we were able to create.
And positions were created in all acute medicine and surgery units, cardiology, mental health, the adult emergency room, among others, at the Health Sciences and St. Clair's. For nursing students outside of St. John's, Malloy says MUN's satellite campuses worked.
Very happy to say that the satellite sites that were set up a few years ago, this is the first year that graduates are coming from Gander, from Grand Falls, and from Happy Valley Goose Bay. And we've certainly offered, and I think we're very close to 100% of those graduates who have accepted roles, and their roles within their communities.
And for nurses graduating from these campuses, it's a lot of moms and LPNs.
I'm a mom of two and a wife. I'm actually an LPN and I'm doing the bridging program.
Brittany Humby lives and studies in Gander, a program she couldn't do if it meant moving to St. John's or Corner Brook.
Having this close to home, I'm able to care for my family while advancing in my career.
Humby's children are 4 and 6. They understand that mom is in school, and she says it's teaching them an important lesson young.
I'm just extremely happy that they can watch, knowing things aren't always easy, but they can see how hard work can pay off.
Humby will graduate in 2027, and the Nurses Union is prepared to welcome these new graduates.
Grow your own has always been a strategy we've talked about when we talk about nursing in Newfoundland and Labrador.
But Coffee has some questions about the new jobs being offered to nursing grads in St. John's.
So we have some questions coming forward about whether or not these positions were actually offered to our members first.
With all this on the table, Coffee doesn't deny that things are likely improving in the healthcare system.
Have we turned a corner with numbers? Yes. Have we turned a corner in the healthcare crisis? We're moving it. Inch by inch, we still have a lot of work to do.
Because what she's hearing on the ground are stories of mandated overtime, patients waiting in hallways, post-op rooms for care, and the continued use of agency nurses. But the tide is slightly changing and more nurses will be on the ground soon. Jenna Head, CBC News, St. John's.